So good afternoon, everybody. Welcome to SkillsforMED. Now we are entering into today's topic. So how to organize ourselves and workplace? It's today's concept. So last week we discussed about the dressing trolley. So we had a lot of feedback from nurses around the globe saying that it was great and they were started to implement in their healthcare system how it is benefiting them like that. So today we are focusing on mastering time management in busy shift, prioritizing task effectively. So today the topic will be handled by Dr. Parivalvan Rajavelu. He is a consultant surgeon, Sundara Medical Foundation, and he is our founder for SkillsforMED. So about him, he is a great orator, he is a quality oriented person, and his keen focus is about starting the SkillsforMED is to enhance the nursing practices and also upskill the nurses and to empower the nursing professionals. So his focus is the nurse must not lay beside the bedside procedure. She has to voice her in the healthcare with a lot of techniques and tools coming up with her to upgrade herself. And I myself will be sharing with sir. I am Stella Townsend. I am the training manager in SkillsforMED. So today's agenda would be, so we'll be giving the quick introduction about the time management and about the task prioritization. So that will be done through the Zoom breakout rooms, and that is a very interesting task. I expect all the participants to have an active involvement in that. So you're going to get a great benefit out of this session. And the third thing will be about handling emergencies without disrupting the workflows. So, the today task is about time management and prioritizing the task. So we should know what is time management. So everybody know. So in the healthcare, it is like every time we have a lot of difficulty in managing time. The main expectation for the other shift healthcare professional would be the previous shift healthcare worker, whether they have done all the tasks. So for that, we should know how to manage our time effectively. If the time management is not happening in a right way, obviously we're going to burn out ourselves. It will be like we are increased with stress, and then our work efficiency goes lost, and obviously it all will get reflected on the patient. The way the care is going to be done and the quality of care is going to be going down if all these things are compromised. So while managing time in a busy shift might be feeling overwhelming at the first, but if you start doing it or managing the time in a very well pattern or with all the techniques involved, it's going to be great trouble at the earlier, but then it's going to be a practice. So you all will be implementing the time management within a week or a couple of weeks of time. So why is it so difficult to manage timing? Because I would say healthcare professionals often face stress, unexpected stress. We used to burn out due to poor time management. We have 8 hours of shift or 9 hours depending on our designation. So we might think we can finish it off within that time at the beginning of the shift. Then later, when the time going to get end, we might have 6 to 7 tasks yet to be completed. That's going to push us into a stressful situation. So that stressful situation, we in the list we have taken the key points like high workload. You might have too many works to be done. So one, starting the shift, you might have a handover list of having 10 tasks to be done, or 20-25 tasks to be done the other day. Every day will be like vary with the task burden what you're going to get. But if you know how to manage the time efficiently, whatever or the number of tasks doesn't matter. The way you manage the time will be the priority way. And long hours, if you don't manage the time, so if you're not managing your time, so imagine your shift ends at 8 hours. So you're going to extend 1 or 2 hours to complete that work for the patient safety, for the continuity of the care. You have to take responsibility in the healthcare. So that is why we are undergoing for this long hours of shift. And of course, in the poll, we had the option, most of them have answered about interruptions and multitasking. That is because you will be doing some work, or for example, you're going for the patient rounds. You would get a phone call where that phone call is going to lead you to the other task. For example, you're going to room number 0. So you're getting a phone call, so that you are not going to enter into the room number 0. You're attending to the phone call. There is a work related to room number 3. So now you're going to take care of the room number 3. So totally the room number 0 is lost. So interruptions are there while you're doing the task, and also multitasking. So you healthcare professional, now we are not limited only to the patient. We are also equally involved in digital system where the digitalization of the things are heading, and then documentation works, and about the indenting, restocking, maintenance. So a lot of works are there for the healthcare professional. So that is also another reason why we are not able to manage the time. So lack of time management, obviously this is the other thing, like we don't know how to do the time management efficiently, and then inability to balance work with personal life. This major reason, I would say, we don't know how to balance what is work and how we have to balance that with our life. You have to voice out, you have to say certain things, you have to escalate to your senior most people and to be get it done. And even with your family, you have to say this is the 8 hour shift, you have all this tasks to be done, how you're going to be busy with that shift, so that balance will great work. So results of poor time management, if you're not able to manage it efficiently, so what you're going to undergo, the stress, what I have already mentioned. So emotionally you will get exhausted. So at the end of this shift, you're going to be having a lot of preloaded contents or the task over your head, and you're going to get tired, and then reduce job satisfaction. So every time you're not managing your time efficiently, the other healthcare professionals who are going to get handover from you, so they are going to fix a mark saying that this particular person doesn't know to manage the time, and always I'm getting the pending task as a handover. That is again it will be reflecting on your job, and it shows the reduced job satisfaction. And also you might feel guilt for not completing the task at the end of the shift. And next things, all these things is going to reflect on your emotional instability, and also you're going to get stressed and then burned out, which actually it is very dangerous getting into the stress. So you have to get rid of the stress, because if you get into the stress, your total mind is going to be like you cannot focus on the patient care. So quality enhancement is going to be a lack for the patients. And also the fourth thing would be like lifestyle related diseases. Too much of stress, automatically a lot of you're going to get into the lot of disease conditions. So you have to regulate your time so that you can get rid of all these four pain things out of your life. So importance of time management, you should know we can do the task at any time, or how to do within the time. So it is very important. So effective time management is obviously it is equal to patient care, better patient care. So prioritizing the task, you get the handover, you take a notebook or the pocket notebook, you mark yourself first which task I'm going to do, which is very easiest task you can complete it off, and the difficult task. So you're going to mark it yourself, and you with your own comfort zone, you're going to mark it up which task comes first, second, third, fourth. You're going to prioritize it with the checkbox, and your end of the shift you're going to tick mark everything, and you're going to leave the shift. And then managing the interruptions, you're getting the interruptions, you can obviously you're getting the phone call, so you should know whether you're going to attend with the earlier example I'm saying, whether you're going to attend to that phone call and carry out that order, or you can make that phone call, attend to the phone call, get the orders noted down, and you're going to attend to previous room where you actually wanted to go, and then carry out this phone call order. So it is again managing the interruptions. Or even you can ask the other person to attend to the phone call where you can carry out with your works, and then get the orders done. So delegating something to someone else without getting interruptions. Optimizing the workflow, you should know the clear prioritization so that you can optimize yourself, or you can structure yourself how you're going to do the works. And stay organized during busy shift. If you prioritize, if you manage interruptions, and if you optimize workflow, all these things are on the in the loop, you're doing it perfectly, then all your tasks is going to be organized. You're not going to get busy even if you get the additional tasks to be done during your shift. And the fourth thing, complete work on time. No, all these four things, you can connect it together. Prioritizing the task, managing the interruption, optimizing the workflow, staying organized during the busy shift. Nothing is going to be a deviations during your duty. So the fourth thing, obviously at the end of shift, you can check your notebook where all the tasks would have been got marked, including the emergency task. So, doctor, I would like to ask you how to prioritize the task because that is the major focus today. So, please help us through to do how to prioritize our task.
Thank you, Stella. I think there are several ways you can do it. I think each person has probably got his or her own way of prioritizing tasks. So, now what we are going to discuss is one way of doing it. I think I wanted to say that in the beginning itself. So, we are going to discuss about one way of prioritizing task, and it is a proven methodology. This is not my way of doing tasks. What I'm going to discuss is a proven way of prioritizing tasks. But before that, I think we plan to have a activity, isn't it?
Yes, sir. We have.
Can you move to the next slide?
Yes, sir.
Okay. So we thought no, we will try and see how much you could get involved in the webinar as well. It's only both of us talking all the time. So we thought we will try this experiment and see how it works. So we're going to divide as of we can divide to up to 200 breakout rooms apparently in Zoom, right? But we're going to
Oh,
divide into only 2 breakout rooms. So we have a few, I think a couple of hundred people here. So we will be divided into 2 breakout rooms. And what we want you to do is we will be giving you 2 scenarios and you need to prioritize that. But before that, I thought I would introduce you to the Zoom breakout rooms. It is new even for us. So that's why we're taking a cautious step in only forming 2 breakout rooms. So what we will do is we will automatically divide the audience into 2 batches. So basically what will happen is instead of all of you being in this meeting room where me and Stella are talking, you will be divided into another room where both of us won't be there. Only you people will be there. So amongst you, one of you have to take the lead and start asking others, how do you prioritize? So we will give you about 8 minutes to discuss this. And I think there are 5 tasks there, if I'm not mistaken. Is it 5?
yes, sir. Four tasks in
4
each.
tasks. Okay. See, these 4 tasks you have to prioritize 1, 2, 3, 4. Which will you do first? Which will you do second, third, and fourth? So, the end of 8 minutes, we will end the breakout rooms. Then all of you will enter into this main room, and then we will ask you, can you let us know what is the order? So we will ask, 1 or 2 persons from the one breakout room and the 1 or 2 persons from the second breakout room to volunteer and tell the order in which we do it. So I think this is going to be a very interesting activity and also get you involved. So let's do that. So can we put the questions first, please?
Yes,
So
sir.
let's have a look.
Sure. These are the questions.
Okay.
So,
So please note it down. I think this may not be visible to you when you go into the breakout rooms. So group 1, there are 4 tasks. Okay. So join a scheduled team meeting, organizing storage supplies, helping a patient with breathing difficulty, drawing blood for routine lab tests. So which will you do first, which will you do second and third, and so forth. For group 2, it's about a teaching assignment about a patient about wound care before discharge, double checking IV fluid expiry dates in the stock room, refilling the dressing trolley for the next shift, giving pain relief to a post-op patient. So these are the tasks which you have in your list, and how would you prioritize? So Stella, can you go ahead and break the
yeah.
do the breakout rooms, please?
Yes, sir. I am the co-host, so I'm not able to do that.
Okay. I think Jayanti, you need to make us one of us the host. Or do you want to do it, Jayanti?
Done it. Thank you.
Okay. So those of you who are still in the main room, please accept the invitation to go to the breakout rooms and then you will get into that. So once you go there, I think you need to discuss about the priorities and then get back here. I hope all of you have understood what we are trying to do.
Not able to view that.
Okay, let's proceed. I think we need to get more
Yes, sir. Yes.
thing in this. Okay, sorry about that.
Yeah.
So
So might be next week we'll come up with the same, other task which can be collaborated for them.
so just,
So
I think, please, if you can raise your hands and tell the priorities, it'll be good. So I want some of you to volunteer. Can you put the slide,
yes,
share
sir.
on the,
Jayanti, make me as a co-host. So can you please make me as a co-host?
yeah.
Yes, sir. Is my full screen is visible, sir?
Yeah.
Yeah. Okay. Participant can raise your hand. So first you can select either of this. Don't mix up group 1 and group 2 activity together. Either you choose group 1 or group 2. I think Nushin Hawmat have raised his hand.
Okay, Nishan, go ahead.
Hello,
Yeah,
good afternoon.
good
Good
afternoon.
afternoon.
How are you, Dr. Pavi? How are you, Ms. Stella? Thank you very much for your nice webinar. Every Friday, I am waiting for it. And for your questions, in the group 1, I think the first one will be helping a patient with breathing difficulty.
Mm-hmm.
Okay. And
Okay.
then the second will be drawing a blood for a routine lab test. And joining a scheduled team meeting, and then organizing storage supplies. This is my opinion, how I prioritize it. If these were my tasks.
Thank you so much.
Yeah,
So
welcome.
you ask, no, quite a few people have raised their hands, so I'm going to ask Anjana, can you unmute yourself and tell how would you prioritize group 2 tasks?
Good evening, sir.
Good
Anjana
evening.
here. Yeah, if you ask me, for me, it would be first to giving pain relief to a post-op patient. That is more important.
Mhm.
And then it would be like teaching a patient about the wound care before he get discharged.
Mm.
And the third would be like double checking like your IV fluid and the expiry dates for the stock room, because we never know when we have to give a fluid on a sudden. And the last would be refilling the dressing trolley for the next shift, because before you leave your shift, you can check it out and refill your dressing trolley. That is how I would prioritize.
Thank you.
Thank you, sir.
And Adusumili Padmaja, do you want to unmute yourself and tell how you do prioritize? Hello? Okay, we'll go to the next person, Shruti or Adeline, and somebody from Nazareth Hospital.
Hello, good evening, sir. I would like to for group that I would go with.
Good afternoon, everyone. So the questions of group 2. So answers will be first giving pain relief to a post-operative patient. Second one is teaching a patient about wound care before discharge. And the third one will be double checking IV fluid expiry dates in stock room. And the fourth will be refilling the dressing trolley for the next shift.
Okay, thank you so much. Right, Adeline and Anjana, do you want to?
Yeah. Adeline spoke just now, sir.
Oh, she spoke. Okay, fine.
Yeah, yes, sir. I think Viswa Vinay have raised his hand.
Yeah.
Whisper?
Good evening, this is Brigadier Usha.
Okay, Brigusha.
Hello,
ahead.
can you hear me?
Yeah, we can hear you.
You can't. Yes, ma'am, we are hearing you. Of course, say, group 2, my first preference will be giving pain relief to the post-op patient. Second will be teaching a patient about the wound care before discharge. Third will be refilling the dressing trolley for the next shift. And the last one will be double checking the IV fluid expiry dates in the stock room.
Okay, that's great. Shall we move on then? Thank you
Yes,
all for joining this discussion. I think we couldn't get the breakout rooms. I think we will practice it more and maybe do it next week. So can we move to the next slide?
Yes, sir.
Okay. So how do we prioritize tasks? So basically, there are two things we need to consider. So one is the urgency. In any, hospital, we only, if there is an emergency, then all other things go down the priority list. And the second, you have to look at, the impact. So what will be the result if we don't do the task? So that will be the impact. And we need to, have a system where we are able to put together both the urgency and importance and try to prioritize tasks. So many times, if you just focus only on the urgent tasks, then important tasks may get left out. So this is why we need to have a system where urgency and importance both need to be taken into account. And the third, of course, which may not apply to people in the healthcare setting, we need to reduce time spent on distractions and low priority work. Distractions, yes, it can happen. And you may not, because if you don't prioritize, then you may be doing the low priority work instead of focusing on the high priority work. So there is a matrix called the Eisenhower Matrix. So Eisenhower, as you know, is one of the presidents of the United States. And he used to prioritize his tasks using this matrix, and that is how this became very popular. Next slide. So this is the matrix. So please take a moment to familiarize you with this matrix. So the red one, if you can see here, on the left side, there is this not important and important written. On the top, there is this, critical or urgent and not urgent written on the top. Okay. So now we divide this into 4 quadrants. So you can take a piece of paper, put a vertical line and a horizontal line, and you will get 4 quadrants. Okay. In this 4 quadrants, the top left is the urgent and important. This you have no option. You need to do it. For example, a code blue or things like that is urgent and important. So you have to drop everything and run, right? So this is the quadrant where you need to do. You don't have any choice. Now, if you go to the next, to the left, right of it, you have important tasks which are not urgent. So here you can delay this a little bit, but then you need to finish it in that particular shift itself. So you can plan to do it later. So these are important or not urgent. Okay. Then if you come to the bottom left corner, you have the not important but urgent. This is typically if you're called for a meeting by your senior person. It may not be important to you, but it is urgent. You need to attend it, right? So here, if possible, if you are in the career ladder where you are possible to delegate this task to somebody else, then you could delegate it. But no, if you're smart enough, you can delegate work, even at whatever stage you are in your hierarchy. And the right side bottom quadrant is not important, not urgent. This you could eliminate or give it to somebody else or postpone. So this is how, not only in your shift, but in your life also, you can use this Eisenhower matrix to divide your tasks or prioritize your task using this 4 quadrants. So important and urgent or critical tasks which you need to do immediately. For example, if it is the last day of paying your electricity bill, that becomes the important and urgent activity. Otherwise, your current will get cut, right? So, but there are certain things which are important and not urgent. For example, you may want to spend some time with your mother or father who's living a little bit away, and you wanted to take some time to spend time with them. It is important, but it is not urgent. But if you don't attend to these, then it becomes a problem. So you may need to plan to do it later. So that is the important, not urgent. And then if you come to the bottom, not important and urgent are things which, as much as possible, you can try and delegate and make more time available for the first two, the top 2 quadrants. And of course, the last right side corner were not important, not urgent. Instagram, Facebook, YouTube, watching, endless scrolling. These are all not important, not urgent tasks which you should eliminate or try to postpone. It's not that we should be all sages and not watch and do Instagram or interact with that. But there is a time for it. Okay, so this will help you to prioritize a task. Now, shall we go and look at how we can prioritize a task which we ask the audience? Okay. So in summary, what you do is you list your tasks first, like whatever tasks are there for the particular shift, you list it. Then, as I said, just take a piece of paper, put a vertical line, horizontal line, and those tasks you try to group it in those 4 quadrants, and then start doing them. If you do it this way, instead of just going through the task list one by one, you don't even know which is important and which is urgent. But if you divide them into these 4 quadrants, then your prioritization will be more scientific. So based on the prioritization, you can decide which you want to do first and which you want to do second. Next slide. So here is how we would divide the tasks which we asked you. Okay. So in the first set, giving pain relief to a post-op patient. I think most of you got it right. No. So that is important and urgent, and that you'll do first. Then teaching a patient about wound care before discharge, because this is again may not be urgent, but if you lose the opportunity, the patient may actually be discharged without being taught how to take care of the wound care. So that'll be the second. So the refilling the dressing trolley for the next shift. It's not important and it's urgent. So because if you don't do it, then you probably will be leaving the dressing trolley in a disorganized manner. So it is not important, but it needs to be done. And finally, the 4th will be double checking the IV expiry dates in the stock room. So this is the 4th thing where you could delegate or postpone it for maybe the next shift if you are too busy to do that for that particular shift. In the second set, helping the patient with the breathing difficulty is urgent and important. Joining a scheduled team meeting is important but not urgent. Drawing blood for the routine lab test is again I would put it as important but not urgent. And organizing storage supplies, of course, is the not important, not urgent category. Okay, so you get a feel of how to do it. Okay, so we are just giving some examples. I'm sure if tomorrow you go down and try this technique, very simple technique, you would have actually prioritized majority of your tasks. I think that's what I would like to point out. Next slide. Yeah, I think if there's any questions regarding this, we'll take it at the end of the session. But let's move into the next scenario, which I think Stella wants to ask about.
Yes, sir. So even though we do all the prioritization and of the task, and we do the time management effectively, we slightly become little nervous when a real emergency, something will enter into our shift which is not really in my task list. So for example, here's a scenario: a team leader So I like, for example, I'm the team leader, busy with the medical surgical unit, and I'm responding to code blue and lead the team in performing CPR for 40 minutes. So the patient is stabilized and transferred to the ICU. That's right. So when I get back to my list, all my routine tasks which have been planned earlier in the shift, it's already backlogged, and I have only limited time now. So that is like delayed medications, pending assessments are there, and code blue documentation is also is there pending for me. So the team feels very overwhelmed with limited time to catch up before attending to the next set of tasks. So how can I manage this situation?
Yeah, I think it's not only for the team leader. Every member of the team, their task gets overwhelmed. I mean, you highlighted your tasks, but I think at all levels, because 40 minutes is a long time, and those who are taken part in the code blue will have a lot of tasks piled up. So this is very, very common occurrence, and I think this is something many of us face day in and day out. And how do we regain control and manage the backlog efficiently? That's the question.
Yes, sir.
So next slide. So as Stella pointed out, even if you do this Eisenhower prioritization or whatever prioritization methodology you use, when emergencies comes, everything it gets thrown out of the window, and then you are left with very limited time to do a lot more tasks. And this is where a lot of stress comes, most of the burnout which happens in healthcare is because of this. Constantly we face emergencies, we face urgent tasks which just keep cropping up in our shifts, and we have no control over it. So when this happens, we have very little time to finish within the shift, and we can't endlessly postpone our task to the next shift, because then it becomes unfair to that person, because they may also go through the same problem. So how do we manage this is a big question all of us are facing. Next slide. So here we have put together what is known as a 5-step rapid task recovery plan. Okay, it's a hyphen name which has been given. But basically, if you look at it is a very common sense thing to do. There are 5 things you could do. You may do it all together, or you may take up one of these or 2 of these and do it. And that will help you in managing this piled up tasks after an emergency happens. But I would think that the first 2 steps has to be done every time. Okay, first is to pause and assess. So as soon as you finished your emergency code blue, you come back, then you realize, my God, now I got to do the same amount of tasks in a very limited amount of time. So instead of getting overwhelmed or trying to get stressed out, you need to pause and assess what is that I have left to do. And then the second is prioritizing these tasks, which we already talked about. And then there is another technique known as task batching. So for the next 1 hour, you could run on what is known as task, power hour, where you batch tasks together and do it. I will explain what is task batching in a short time. And the 4th, of course, is delegating. There may be some tasks which you can actually delegate. So think whom you can delegate and delegate these tasks, and so that you get your time freed up to do the tasks which you must do. And finally, even about half an hour or 1 hour before the shift ends, give some time to review and reflect. So in the next final hour, what is that I'm going to do? How am I going to tie up all the tasks which I have? And if I'm not able to do it, what are the tasks which I may have to hand over to the next shift? So this is a very, it's known as a 5-step task recovery plan. You're calling it task recovery because you sort of fallen off the wagon because of some emergency. So you need to get back on track. So how do you recover the time, or the task planning is what we are going to talk about. So can you go to the next slide? So this is the first step. Pause and assess goes by the acronym STOP. So instead of straight away walking from an emergency, which is because of which you have not been able to do your pending tasks, instead of straight away going and starting all the tasks at once, you have to stop. So the stop, each word has a meaning. I mean, each letter, sorry, each alphabet has got a meaning. So S stands for sit down or stand still for a moment. Very important. Okay. Take some deep breaths, sit down or stand still. Otherwise, you tend to get stressed out. Then T stands for take a deep breath and focus. So first is to stop. Either if you can sit down, it's fine. Otherwise, at least you stand still in a place you won't be, there is not much of distraction. And then take deep breath and refocus. Then you'll take a look at the pending tasks, and P stands for prioritizing what needs to be done first and next. Okay. So the first thing is to stop before you move on doing the rest of the task. This will greatly help you to reduce your stress level. So the first step of the 5-step is pause and assess, where you sit down, take some 3 deep breaths, look at your pending tasks, and then you prioritize. Next. So the prioritizing, I don't need to tell you now. We've already discussed the Eisenhower Matrix. So one way to decide is, will delaying this task affect patient safety? This is something which we may need to think about, because this Eisenhower Matrix has been applied mainly in the business world. So if you go on the net and search, and if you probably ask ChatGPT also, it may not tell you about patient safety prioritization. But I think we need to be very, very careful about this. If at all you put some tasks in either delegate or delete, before putting it, ask yourself, will delaying this task, will it affect patient safety? And can another member of the team handle this while I do the more critical task? That is delegating. Okay. So you have the advantage of having the team, and you also are aware of the patient safety. So these should be, also put into account when you are prioritizing the task. So the 5 steps, first is to stop, and the second step is to prioritize. What is the third step? So this is what I was telling. The next 1 hour, you do what is known as task batching. You could probably do it anytime, but it helps when there is a lot of work to catch up. Okay. So you need to, what is task batching? Is batching similar tasks together to reduce interruptions. So you could combine the medication rounds with vital checks. I'm just giving you some examples. You can be more innovative and batch tasks together. So you could do them both together at the same time. Or when you start documenting, instead of seeing one patient and documenting, then going to the next patient and documenting, this task switching, this is called task switching. So when you keep on switching tasks, that is, one is, you go to the patient, do the assess the patient or do a medication round. So that is your brain is in a separate, different frame of mind. Then when you come to documentation, the brain has to switch into a different frame of mind, and it takes some time for you to become efficient in it. So that is why, if you do diverse tasks one after the other, you become very slow in doing it. So by batching similar tasks together, you will be able to be more efficient. So you could see, 5 patients at a stretch, and then do the documentation for all of them together. So this is the crux of what is known as task batching. And then you can also, for example, do answer for patient needs while checking in. Okay, so there is this 5 safety checklist while leaving the patient. So instead of asking one by one, you sort of put all the questions together into one checklist and ask them before leaving the room, so that they don't ring the call bell again. Okay, so we will I think we dealt with it when we talked about handing over. So basically, the third step in recovery is task batching, but you cannot do endlessly. You set a time for this and try to run it as a sprint. Sprint means you run very fast. So your mindset also, you are thinking, okay, let me finish as much of documentation as possible in the next 15 minutes and finish up all the documentation together. Your mind will be in the time frame for documentation, and you become more efficient. So that is the third strategy. Okay. First is to stop. The second is to prioritize your task. And the third is do what is known as task batching instead of task switching. Next. The fourth one is delegation. Okay, we already spoke about it. So do what tasks you should handle yourself. Okay, if there is something which you need to do, dressing change or urgent meds, you are the only person in that particular team who's capable of doing it, do it. There's no option for that. But if there are other tasks which are not critical and your team, there are members who can do it, for example, documentation is one example, or you could even say, for example, phlebotomy. No, suppose you have to draw blood. So you could request the phlebotomist to do that instead of you spending time on that. So delegation is very important. And sometimes you could defer it. Okay. You could say, okay, I'm going to do it at the end of the shift. So because we know in the prioritization, we know that that is not that urgent. So we could defer it to the later part of your shift. And there are certain tasks you could smartly not do and pass over to the next shift. Don't tell anyone that I told you. Okay. So this is something which you could do, but all these things will help you to free up time and finish the important tasks. If you're using the Eisenhower Matrix, you would have completed all the critical and important tasks, and only you're leaving behind routine tasks and things like that for people in the next shift. So they won't sort of be very angry with you. So that's the fourth one, delegating. So one is stop and reassess. Second is prioritize. The third is task batching. The fourth is delegating. And what's the fifth one? Fifth one, as I said, as the shift progresses, before the end of the shift, about half an hour or 1 hour before your end of the shift, review and reflect. You still have got some time before you end the shift. So you sit back and think, get your task list again. So did all the critical tasks get done? And if there is any task which is pending for the next shift, you make a note of that. And then finally, again, before you sort of leave, you again take 2 minutes to really take some deep breaths, center yourself, and put yourself in a different type of time frame. Otherwise, if you don't take this time to reflect and review, you will still be in that hurry mindset, what is known as urgency mindset. Urgency mindset is the most important cause of lifestyle-related diseases like hypertension and diabetes. All our lives, we have some urgency that, oh, I must do this, I must do that. So you should every now and then pause and take some time and try and get out of that mindset. Very, very important. And this you could do before the shift ends. So that is the 5-step plan. If at all some emergency throws your shift out of control. So that's something which I thought will be very useful for others to that we could share. Okay, so I think we need to look at your shift as the mid shift where you do this review and reflect, and at the end of the shift tie everything together to ensure all the critical priorities are completed. And very important is just be flexible. Now things will happen in every shift, which will you won't be able to do things according to what you planned at the beginning of the shift, just as in life. So be flexible, don't be very rigid. That will put a lot of stress on you. And shift your priorities whenever needed. But you keep this tool to reprioritize every now and then, whatever task is at hand. So you might have planned to do 100% of a task at the beginning of shift. But at the end of the shift, when you reprioritize, you would probably be satisfied if you have done about 60 to 70%. But make sure you have done all the important tasks by prioritizing it. That's the key. So if you do 70% randomly, then some critical or important task will get left out and the patient will suffer. So that we need to be very, very aware of. Okay. So I think, is there anything else we got to say? Next slide.
We are almost to the end, sir.
Okay. Okay, I would leave you to summarize, Stella.
Yes, sir. So we have come to the end. So efficient time management, obviously, if you are going to use the proper Eisenhower matrix, where so far we were discussing about. So if you use that, that will enhance your workflow. You will be completing all the tasks within that time, and you know which has to be done by you and which you can seek help from others. You can delegate, or you can eliminate the task and give handover to other shift. And by that, you can reduce the stress and improve the patient care. And also use the structured prioritization tools, that is the Eisenhower matrix, and manage crisis efficiently with rapid task recovery plan. For example, if you get the crisis, how doctor was explaining, you get the crisis, you get the code blue, for example, in middle of the shift, then again you have to reconsider about prioritizing the task, implementing the same matrix. Stay adaptable and adjust priorities as the shift evolves. So always don't be very rigid. You have to be flexible, what the lastly it was discussed. And so one more thing we have, sir. The thing is, sir?
Yes, tell me.
Yeah. So every time, even when I was working in the hospital, when I was starting my career as a junior nurse, my senior used to come and say, if I'm looking so stressed up, I was working in the theater. So in middle of surgeries, after long hours surgeries, I have to scrub it again, which is not actually I was assigned for it. In middle of emergency, I have to scrub for the case. So after 6 or 7 hours of standing for one surgery, going for that, it's again a stress for me. Might be I might have some other work piled up like that. So she used to tell me, like, take a deep breath. I used to think, why I have to take a deep breath when I don't have time to breathe? So that was I used to think. So we have a video here to share with others why that deep breathing actually plays a vital role in healthcare system. So can I play that now, sir, for everybody?
Sure. Yeah.
Hey nurses, you give your all every day. Now it's time to give yourself a moment to breathe. Literally, let's do this together. Sit up tall. Let's start. Breathe in through your nose for 4 seconds. Ready? Go. Now hold it for 4 seconds. And slowly breathe out through your mouth for 6 seconds. Let's go. Feel that calm sinking in? Let's do one more round together. Inhale, hold, and exhale. That's it. Deep breathing reduces stress, clears your mind, and helps you reset in just 1 minute. Save this reel and follow it during your next break.
I think everybody would have done the deep breathing exercise together when the video was running. So one important thing, always don't use your chest for breathing, use your belly for breathing. Because, the main reason for the stress is the cortisol hormone. So to shut down the cortisol production, the vagus nerve has to be triggered. So when you do the deep breathing, you can see, visually you can see, we all would be, our chest will be raising up and the abdomen will be going inside. So actually the idea behind the deep breathing, when you deep breathe in, the lung will get expanded, the diaphragm get expanded, which comes down where the abdomen, the belly part is going to come out. So imagine that abdomen as a balloon. So when you inflate, you blow inside. So when you inhale, the abdomen should come outside, and when you exhale, all the air is coming outside. Automatically, I say referring that belly part to the balloon, all the air is exhaled outside, so the belly is going to go inside. So when inflation, when you're inhaling, when the abdomen is getting extended, so vagus nerve is going to get triggered. Automatically, it's going to get alert and it's going to shut down the cortisol production, where your stress hormone will get reduced and you will get rid of it, and you can focus in your routine task with efficient time management. So this is up from my side, sir.
Yeah, that's a fantastic tip. I think that it's also known as diaphragmatic breathing.
Yes, sir. Yes.
The diaphragm down. I think probably this video you should share with everybody, in the who have attended the webinar, and along the certificate maybe. And
definitely, sir.
Also put in the WhatsApp group. I think it's a very nice short video, but it gives you practical tips of how to do it.
Yes.
That was a nice one. Thank you.
Thank you, sir.